Welcome back. COVID case rates are soaring. Is there any end in sight? And is this winter surge from Christmas time is it peaked yet? We're breaking it all down. Dr. Nicholas Testa, the chief medical officer with Dignity Health, Southern California. He joins us now. Thanks for joining us, doctor. And I want to talk about that case rate number. Every day we're showing these huge numbers, but is that really the best way to measure this pandemic at this stage?
There's so many different ways to look at data, and the public has been inundated with new data. So the couple things that I recommend is, firstly, you need to look at over a continuum, right? So you need to look at, are we on an upswing or are we downswing? That's critical, right? The other thing is, remember, we want to look at, 7-day averages to soften out those big steep spikes. But I'll tell you, the thing I look most closely at is hospital bed utilization. That becomes really, for me, the most critical because that tells us how close our systems are to being pushed to their max.
Right. And the infection rate does continue to go up in LA County. Is this the surge from Christmas and New Year's we're seeing, or is that still to come?
This is the surge from Omicron. So I definitely think that Christmas and New Year's are influencing it. I think what we're seeing right now probably is influenced by Christmas, and we'll probably see it influence New Year gatherings, influence that also. But this is really Omicron spreading through our community. And in the hospitals, what we're seeing is a really precipitous spike upwards of hospitalized patients. Now, I will remind you of the stat that you put out there, which is, we're still only about a third of as busy as we were as far as hospitalizations go a year ago, but we're already at the number of staff quarantined. So that's where our real big challenge is in the hospitals, is our staff is getting sick like everybody else.
Right. Booster shots, meanwhile, available for children ages 12 to 15. What kind of impact could that have in stemming the spread of Omicron, especially in schools?
It's another step forward, right? It's another intervention that we're responsible as parents to make sure that our kids get those booster shots. The truth is that this whole thing has been disruptive for everybody. But the fact is, you, me, the adults in the room, we're all going to hopefully be looking back on this a year or two from now. But our kids are never going to get to do, their 8th grade graduation or their high school graduation again. So we have to be able to keep them in school, and getting them vaccinated and boosted is how we do that.
And, Doctor, the mask mandate's been extended, and lately there's talk about the lack of effectiveness for cloth masks against Omicron, and now they're talking about surgical N95 masks. What do you think?
Yeah. So we have to remember that when COVID started, 18 months ago, we didn't have enough masks. So just to keep us safe, we started using cloth masks, but they were never the best solution. The recommendation has really always been 3-ply surgical disposable masks are the best solution. That's what we use in hospitals. We don't have people walking around in cloth masks. We use a 3-ply surgical mask. I would recommend, with how contagious Omicron is, that if you're in large gatherings around many people, using a KN95 or an N95 is going to provide you that extra level of protection, right? This is really about decreasing the contagious nature of the disease.
All right. A lot to talk about, Doctor. Thanks for all the information. Dr. Nicholas Testa, Chief Medical Officer from Dignity Health, Southern California. Thanks for joining us this morning.
Thank you so much.